Thanks so much for being with us. It is 3:24. So I was pretty surprised to read that at least 15 to 30% of Canadians live with obstructive sleep apnea. Many more don't even know that they have it, and it's causing excessive daytime sleepiness. So two Canadian researchers say they have found the most effective treatment for this. Let's find out more. Dr. DENA ZERATKAR and Dr. Tyler PITTE from McMaster University join us now. Thank you so much for your time today to both of you.
Thank you for having us.
So let's begin with you, DENA. How do you know if you have obstructive sleep apnea? Now, we're talking about the 15 to 30% have been diagnosed, but many more others have not. So what would the signs be?
Yeah, so obstructive sleep apnea is a sleep disorder that's sort of characterized by recurrent episodes of partial or complete blockage of the upper airway during sleep, which sort of leads to disrupted breathing patterns and poor sleep. And so most patients with sleep apnea present with daytime sleepiness, but their daytime sleepiness is typically improved by conventional therapies for obstructive sleep apnea, like CPAP or BiPAP, which delivers sort of flow of pressurized air into the airway.
Okay. And then Tyler, in terms of having this excessive daytime sleepiness due to it, if you have sleep apnea, do you automatically have that daytime sleepiness?
Yeah, it's an interesting question. So most patients at diagnosis with obstructive sleep apnea, 50% of them will typically have like evidence of daytime sleepiness, but most of that is resolved after they, adhere to their positive pressure or their CPAP treatment. And for those who don't know, that's basically a mask that you wear at night that allows you to keep your airway open when you sleep. But a good proportion of patients, 18% of them, when you look at the actual numbers, that's actually quite a few patients, don't actually get any better with the CPAP therapy, and they don't feel very, happy that the treatment's not working. And then, of course, their quality of life is affected throughout the day because they remain sleepy. So it is quite something that it is definitely prevalent on diagnosis, and then unfortunately still persists in many patients, even if they comply with treatment.
Yeah, that's interesting. I thought once you were on that CPAP treatment, that was the whole idea of getting better. You're suggesting that's not always necessarily the case. So what is the solution here, and what have you come up with?
Yeah, precisely. So, up to 18% of people will still suffer with daytime sleepiness. And so there are a number of medications that have been trialed throughout the years, but none of them have compared to each other. And, reasons for why drugs aren't compared to each other is, feasibility. It's difficult to do that. And so what we did was perform a type of a meta-analytic method that compared all of these drugs at one time. Like, imagine as if we had one big randomized control trial. And what we found was that this newer drug called solriamfetol, it's a bit of a hard one to say, was the most effective at reducing your daytime sleepiness in patients with obstructive sleep apnea, followed by some less effective drugs.
Okay, Dena, I want to bring you back in on this, and I actually want to take a step back for a second here. When we're talking about excessive daytime sleepiness, are we talking about not able to go about your normal functions, can't do your job, can't perhaps drive a car, or what are we talking about here?
Yeah, of course. So patients can experience this on like a spectrum. So a lot of people can be severely affected by it, experiencing drastically impaired quality of life, whereas others may experience it to an extent. And it sort of varies amongst patients, and it depends on how effective conventional therapies for obstructive sleep apnea have been for them.
Okay, and Tyler touched on this study and this drug that was, I'm not even going to try to pronounce it, this drug that is likely the best. How many people did you look at, and tell us a little bit more about those results?
Yeah, of course. So as Tyler mentioned, we performed a systematic review and network meta-analysis, which is essentially looking at all the previous studies that have been published on this topic, addressing the effectiveness and safety of these drugs. When we looked back in the literature, we identified 14 trials, including over 3,000 patients. And based on these results, so through a statistical method that Tyler mentioned called network meta-analysis, we pooled the results of all of these trials together and compared the effectiveness and safety of these drugs with each other. And so we found solriamfetol to be likely better than other options, although our modafinil, and pitolisant also likely reduce daytime sleepiness as well.
Okay, so I'm guessing what happens, and Tyler, you can talk to us a little bit more about this perhaps. But so you try your machine's not working for you. You're experiencing excessive sleepiness during the day. So you go to your doctor and you ask for these kinds of medications.
Yeah, so you know what? It's actually it's kind of an interesting thing that I don't think this condition is very well known amongst even like physicians in general. It's definitely something that's more known in the kind of sleep medicine, pulmonary medicine specialty.
Okay.
But for the average family physician or non-pulmonary medicine specialist, this might not be a condition that you've really kind of, at least kind of given a name to. You kind of say that your patient is still sleepy, but you may not understand that this is in itself a specific disorder. And so, it might be difficult or it might be, challenging for a primary physician to actually, go right to these medications without maybe doing some secondary research into the condition or ask themselves, why is my patient still sleepy despite being on therapy? But the idea would be eventually either through your family physician or through your sleep medicine specialist that they would offer you some medications to see if that would improve things. Yeah. So for patients who are still sleepy, that is something that they should bring up with their primary care physician, or if they have a sleep medicine specialist, to bring that up as well.
Okay, we're out of time. We've got to get to news, but just quickly, I understand that this could potentially work for chronic fatigue syndrome and long COVID, like long haulers down the road. Is that a possibility?
Yeah, so we hypothesize that these drugs may also be useful in other conditions in which patients experience fatigue and daytime sleepiness, examples of which, as we mentioned, is chronic fatigue syndrome and long COVID. So future research could definitely investigate the effects of these drugs for these conditions.
Very interesting. Thank you both so much for your time today.
Thank you.
Thank you so much.
All right. So I guess don't put it off, right? If you're seeing someone already for this, it's interesting to note that, perhaps a GP, not necessarily
that part
all that
really,
familiar with this,
yeah,
right? So
that
make
really
sure
stayed
you
with me.
Push it.